Hello, welcome to the high cholesterol presentation. My name is Pamela Kevitch, and I'm the Senior Health Promotion Specialist at SummaCare, and I will be your host. This presentation focuses on explaining what cholesterol is, including the different types, various levels, and the risks of high cholesterol. In addition, we will identify tips to lower those levels. While all dimensions of wellness need our attention, there doesn't have to be balance among all of the dimensions at a given time. Instead, the goal is to find harmony with the dimensions that are most authentic for you in the moment. This presentation will focus on the physical domain by adopting healthy habits and avoiding or minimizing risky behaviors that are hazardous to our well-being. Per the CDC, high blood cholesterol is a common condition that affects many Americans. 86 million US adults age 20 or older have high total cholesterol levels that are greater than 200. Nearly 25 million adult Americans have total cholesterol levels that are higher than 240. 7% of US children and adolescents aged 6 to 19 have high total cholesterol levels, and slightly more than half of the US adults who could benefit from cholesterol medicine are currently taking it. High cholesterol has no symptoms, so many people don't know that their cholesterol is too high. A simple blood test can check cholesterol levels, and knowing your cholesterol levels can help to reduce the risk for heart disease. Blood cholesterol is a waxy, fat-like substance made by your liver. Your body needs cholesterol to perform important jobs, such as building cells, making hormones, and digesting fatty foods. Your liver makes all the blood cholesterol it needs, which is why experts recommend that people eat as little dietary cholesterol as possible. Dietary cholesterol is found in animal foods, including meat, seafood, poultry, eggs, and dairy products. When cholesterol, also known as plaque, builds up in the arteries begin to narrow, which reduces or blocks the flow of blood. In addition, your body also stores triglycerides, another form of fat in the blood. We'll review triglycerides in a moment. There are two types of cholesterol found in your body. High-density lipoproteins, known as HDL. HDL is the good type of cholesterol that helps reduce high cholesterol levels. HDL helps to carry excess cholesterol away from arteries to the liver for removal, therefore protecting your heart from heart disease. We all can increase HDL levels through increased physical activity and exercise. Low-density lipoprotein, LDL, this is your bad type of cholesterol that carries cholesterol to your cells. When the amount of LDL is high in our blood, it may cause plaque deposits on the arteries, causing blockages, leading to heart disease. A cholesterol test or screening tells your healthcare provider the levels of LDL and HDL cholesterol found circulating in your blood. This information helps your healthcare team determine your risk for heart disease or stroke. Triglycerides are a type of fatty substance in the blood which comes from the food we eat. Triglycerides are a terrible type of fat and is the most common type of fat in our body. Although it provides us with energy, it makes our blood thick and sticky. When you think of fat developing and being stored in your hips or belly, you're thinking about triglycerides. They are the end product of digesting and breaking down fats in food. When you eat, your body converts any calories it doesn't need to use right away into triglycerides. The triglycerides are stored in your fat cells. Later, hormones release triglycerides for energy between meals. If you regularly eat more calories than you burn, particularly from high carbohydrate foods, you may have high triglycerides. Triglycerides and cholesterol are different types of lipids that circulate in your blood. Triglycerides store unused calories and provide your body with energy, while cholesterol is used to build cells and certain hormones. If you recall, I mentioned buildup known as plaque. Let's dive a bit deeper. Plaque is made up of cholesterol deposits. Cholesterol can join with other substances to form a thick, hard deposit on the inside lining of the arteries. This can narrow the arteries and make them less flexible, a condition known as atherosclerosis. If a blood clot forms or a piece breaks off and travels in the bloodstream, blocking an artery or reducing blood flow, chest pain or heart attack or stroke may result. Coronary artery disease, otherwise known as CAD, is the most common type of heart disease, and it is the leading cause of death in the United States. CAD happens when arteries build up with plaque and cause atherosclerosis. CAD can also weaken the heart muscle and cause heart failure. There are no signs or symptoms to indicate high cholesterol levels. Therefore, it is necessary to have a blood test. All adults should have their cholesterol checked at least every 5 years. It is recommended to start checking cholesterol at age 20. Your blood is drawn at a lab only after you have fasted or not eaten for at least 9 to 12 hours. And this blood test will tell you about your cholesterol profile. So what are the desirable levels? For LDL, we'd like to see less than 100. For HDL, a range of 40 to 60. However, a higher number is better. Total cholesterol, less than 200. And triglycerides, less than 150. Knowing your numbers for cholesterol, here are the goals to achieve. Cardiovascular disease causes approximately a third of all deaths worldwide. They often develop silently over decades. Let's review the risk factors that affect cholesterol levels, starting with the non-modifiable risk factors, those you cannot change. First, age. LDL levels typically rise with increased age. Unfortunately, due to our current worsening lifestyles, we are seeing more and more younger people experiencing heart attacks. Second, gender. Women have higher LDL than men after menopause, but lower prior. It is a fact that males experience more heart attacks compared to females. The approximate ratio is 9 to 1. The female ovary secretes specific hormones from 15 to 50 years of age, which is the most probable reason for this discrepancy. Third, ethnicity or race. Your place of origin, your body shape and color, all of these factors are ethnically derived, which is not in your control. And last, fourth, family history or genetics. Your family history or genetic design may keep cells from removing LDL cholesterol from your blood efficiently or cause your liver to produce too much cholesterol. We cannot change those inherited genes, and because of our genes, which have come from one or both of our parents, our liver may produce more cholesterol, which in turn leads to increased possibilities of heart disease. All of the above risk factors may be slightly modified by following a better lifestyle, such as a low-fat diet, physical activity, exercise, and stress management, and by the use of prescription medication if needed. Now let's review the risk factors that are modifiable, those you can change. First, having extra fat around the stomach area and being overweight can increase your LDL cholesterol and lower your HDL. Having a body mass index, or BMI, of 30 or greater puts you at risk. In addition, risk increases if you are a male with a waist circumference at least 40 inches or more, or a female with a waist circumference of at least 35 inches or more. Next, diabetes is a factor. High cholesterol can change your body's ability to respond to insulin. If the body cannot respond properly to insulin, it has trouble regulating blood sugar levels, which can lead to prediabetes, diabetes, and other complications. Studies have shown that those who have diabetes are much more likely to develop heart disease. This risk further increases if the diabetes is not controlled and managed properly through healthy lifestyle habits or medication. Next, dyslipidemia is a factor. Dyslipidemia is a medical condition that refers to an abnormal level of blood lipids. The most common type is hyperlipidemia, or high lipid levels, and the less common form is hypolipidemia, meaning lipid levels are abnormally low. Dyslipidemias can affect any lipid parameter, including LDL, HDL, triglycerides, or a combination of these lipids. As we have reviewed, having high LDL level increases the risk of plaque buildup in the arteries of the heart. Next, high blood pressure, also known as hypertension, is a major risk factor for heart disease and, in fact, the #1 risk factor for stroke. Consistently high blood pressure can damage the arteries and the heart. Over time, this could lead to major complications, including heart disease and stroke. Fortunately, through a healthy diet and regular exercise, a healthy blood pressure can be maintained. Next, smoking contributes to plaque buildup in the arteries and increases the risks for other diseases, such as various cancers. There is no safe level of smoking that will not cause damage to the heart. However, the less an individual smokes, the better. Next, simply stated, alcohol misuse is a possible factor. Next, fatty meats, whole fat dairy products, deep fried foods, fast foods, and processed foods all contribute to an increased LDL level. Next, lack of physical activity or exercise impacts the HDL level. HDL is beneficial for the heart, and studies have shown that regular exercise can help to increase the HDL level and protect the heart against heart disease. And last, extreme levels of stress impacting a person's psychosocial response can lead to high blood pressure, high cholesterol, and a higher likelihood that plaque may build up in the arteries, which can lead to heart disease. Take the time to review stress reduction options and techniques. I bet you're wondering how you can lower your cholesterol levels. First, stay active. Routine exercise or physical activity can lower high cholesterol. Even 30 minutes of physical activity 5 days a week or 20 minutes 3 times a week for vigorous exercise such as jogging can help lower LDL and raise HDL. Being active also helps you reach and keep a healthy weight, reducing your chances of developing clogged arteries. You do not have to exercise for 30 minutes straight. You could break it up into 10-minute sessions. If you're not used to exercising or don't want to go to a gym, take a walk. It's easy, healthy, and all you need is a good pair of shoes. Aerobic exercise, known as cardio, such as brisk walking, lowers risk of stroke and heart disease, helps you lose weight, and keeps bones strong. If you're just starting out, try a 10-minute walk and gradually build up from there. You can choose to work out without going to a gym. Consider gardening, dancing, even housework can qualify as exercise, as long as it gets your heart rate up. Next, eat healthy. Avoid or reduce foods that are high in cholesterol or saturated fats from your diet. We all need a little fat in our diet, about 25 to 35% of our daily calories, but the type of fat matters. Unsaturated fats like those found in canola, olive, and safflower oils help lower LDL and may help raise HDL. Saturated fats like those found in butter and palm oil and trans fats raise LDL. Even good fats have calories, so eat in moderation. Next, know your numbers. Have your blood cholesterol checked as directed by your healthcare provider. Please follow your doctor's advice. Managing your cholesterol is a lifelong process. See your healthcare provider regularly to monitor your health. Follow their recommendations on diet, exercise, physical activity, and medication. Working together, you may lower your cholesterol levels and keep your heart beating strong. Next, remember, take medicines if prescribed. A healthy lifestyle helps to keep you on the lowest dose of medication only if you take charge of your health. If you have high cholesterol, you and your healthcare provider may use a number of strategies to lower cholesterol levels, and taking a prescribed cholesterol drug may be part of that strategy. Do not deviate from your prescribed medication without talking to your healthcare provider. Remember, you can't feel high cholesterol until it's too late. Next, do your best to maintain a healthy weight. If you are overweight or obese, try to lose weight. Losing weight can help lower your LDL and total cholesterol levels. It will also raise your HDL and lower your triglycerides. Losing weight is one of the best things you can do to help prevent heart disease. Extra pounds make you more likely to have high cholesterol, high blood pressure, and type 2 diabetes. These all affect the lining of your arteries, making them more likely to collect plaque from cholesterol. And last, stop smoking. Talk with your healthcare provider about programs, products, and medication that can help you quit smoking. Try to avoid secondhand smoke as well. Here are the food sources. Saturated fats and oils, such as butter, bacon grease, lard, palm, coconut oil. You want to use oils such as canola or olive. Trans fats are partially hydrogenated vegetable oils. Those are found in snacks, crackers, cookies, chips. Oils that are solid at room temperature, such as hard margarines, are the ones to stay away from. Limit fatty meats, such as processed meats, ribs, steak, ground beef, sausage, bacon. Limit meat, poultry, and fish servings, no more than 2 5-ounce servings per day. And limit milk products, most cheeses, cream, whipped topping, and milk greater than 1% fat. Foods to lower cholesterol. First, start your day with whole grains. A bowl of oatmeal or other whole grain cereal has benefits that last all day. The fiber and complex carbohydrates in whole grains help you feel fuller for longer, so you'll be less tempted to overeat at lunch. Other examples of whole grains include wild rice, popcorn, brown rice, and barley. Beans and whole grains, such as brown rice, quinoa, and whole wheat, have more fiber and keep sugar levels in check. These help lower cholesterol, especially LDL, and keep you feeling full longer. For heart health, look to the C. A heart-healthy diet should have fish on the menu twice a week. Why? Fish is low in saturated fat and high in healthy omega-3 fatty acids. Omega-3 fatty acids help lower levels of triglycerides. They may also help lower cholesterol, slowing the deposits of plaque in arteries. Go for fish, such as those listed below. Just don't drop the fillets in the deep fryer. You'll undo the health benefits. Go nuts. Need a snack? A serving of nuts is a tasty treat that helps in lowering cholesterol. Nuts contain high levels of monounsaturated fat, which lowers LDL while leaving HDL intact. Nuts are high in fat and calories, so eat only a serving. In addition, make sure they're not covered in sugar or chocolate. Olive oil acts as an antioxidant to decrease LDL and does not affect the level of HDL. Choose to use olive oil in place of vegetable oil. And last, serve up the fruits and vegetables. Load your plate with fruits and vegetables, 5 to 9 servings a day to help lower LDL. Fruits and vegetables contain fiber that stops the digestive tract from absorbing cholesterol. Legumes, such as chickpeas, lentils, beans, and peas, are good for people with high cholesterol levels because they contain soluble fiber to help lower cholesterol levels and take longer to be digested. Apples, citrus fruits, grapes, and strawberries all contain pectin, which is a special type of water-soluble fiber that holds together cholesterol in the stomach and prevents it from getting into the bloodstream and clogging the arteries. Tips for grocery shopping. First, don't stress out. Chronic stress can raise blood pressure, adding to your risk of atherosclerosis. Research shows that for some people, stress might directly raise cholesterol levels. Lower your stress levels with relaxation exercises, meditation, or biofeedback. Focus on your breathing and take deep, refreshing breaths. It's a simple stress buster you can do anywhere. Next, check the food label. A close look at nutrition labels is a key for a low cholesterol, heart-healthy diet. Check serving sizes. The nutrition info may look good, but does the package contain 2 servings instead of 1? If it says whole grain, read the ingredient list. Whole wheat or whole grain should be the first ingredient. Note the saturated fat. Is it within your diet's limits? If you're eating healthy food at home to keep cholesterol in check, keep it up when you eat out. Restaurant food can be loaded with saturated fat, calories, and sodium. Even healthy choices may come in supersized portions. Use these tips to stay on track when you go out to eat. Portion control. Lend a hand. What do I mean? There is an easy way to practice portion control for a meal. Use your hand. 1 serving of meat or fish is about what fits in the palm of your hand. A serving of fruit should equal the size of a tennis ball. A snack serving will fit into the palm of your hand. A teaspoon of a condiment is about the size of the tip of your thumb. A serving of cooked vegetables, rice or pasta, or a half-cup serving of raw veggies or fruit, or a cup of raw leafy green veggies should fit in your cupped hand or resemble the size of your fist. Choose broiled, baked, steamed, and grilled foods, not fried. Ask for sauces on the side. Salad dressings are a perfect example. Practice portion control by asking for half of your meal to be boxed up before it's brought out, or simply plan to only eat half of the meal and take the other half home for lunch for the next day. Take-home message. Too much cholesterol is harmful to your body. It can cause decreased blood flow to your heart and brain, which can lead to a heart attack or stroke. There are 2 ways to get too much cholesterol. Your body makes too much due to hereditary, age, and/or gender, or you may be eating too many foods high in cholesterol or saturated fats. And last, get your cholesterol checked. There are no signs or symptoms for high cholesterol. SummaCare resources. We encourage that you have an annual visit with your primary care provider. We do offer condition and care management for those who may be diagnosed with a chronic condition or have complex needs. We do offer access to diabetic testing supplies. We offer telephonic health coaching for lifestyle behavior management. You have access as a SummaCare member to WebMD Health Manager through Plan Central, which offers a plethora of education. You also, as a member, have 24-hour nurse line access where you have access to a SummaCare nurse 24/7, 365 for any of your medical questions. You also have access to Teladoc Health, which is your telemedicine feature while traveling or in need for minor medical issues and concerns. We do offer our Quick Care Smoking Cessation program, which is a telephonic coaching program that offers limited nicotine replacement therapy. And you also have access to discounted health club memberships through HUSK, as well as nutrition programs and educational resources. Thank you so much for being a part of this presentation. Here are the resources that I used to create this presentation for you. And as always, follow SummaCare on any of the listed below social media platforms. Take care. Thank you and be well.